So next up we have Dr. Josh Faulkner. He's a lecturer at Victoria University of Wellington, and he's a registered neuropsychologist also working clinically. So great to have his perspective today as a clinician researcher. And he's going to share with us some of his latest work on mental health, on why mental health difficulties impact recovery after brain injury and what we can do about it. Thanks, Josh.
Tēnā koutou katoa. I'm wondering if we would, as a group, be willing to do a little exercise or a strategy together. I'm just really aware we've had a very difficult presentation and there's been quite a lot of stimulation already. So for those who are willing, this is by all means voluntary, but please close your eyes. And I'd just like you to just take a moment and scan your body. And as you take this moment to scan your body, I'd just like you to notice what might be coming up for you. Whether there's a physical sensation you're noticing in your body, whether there's a thought in your mind, or if there's a physical sensation, I just want you to connect with it. And I want you to say to yourself, I'm noticing, I'm feeling. Just in your head, whatever that sensation might be, whatever that thought might be, I'm noticing, I'm feeling. Now what I'd like you to do is to connect with your body. So I'd like you to plant your feet into the floor and just really notice the sensations of your feet as they connect to the ground. And I want you to just kind of move your body as much as you can or are able to, just moving your shoulders up and down. And just really connect with that physical sensation. So your mind might go to places. What's this guy doing? This is weird. Just notice that thought. Come back into your body and just notice that feeling. And now I'd like you to just take a deep breath. Slowly breathe in. And then slowly breathe out. And come back to that sensation that you noticed in your body. It's still here. There's still that feeling. There's still that physical sensation, or there's still that thought. I'm noticing, I'm feeling. And come back into your body one more time. Plant those feet onto the floor. Take that deep breath. And again, slowly exhale. And now I'd like you to open your eyes and just to engage in your surroundings. So what I'd like you to do is just name a couple of things in the environment that you can see. Name them in your head, but just really notice what it is that you're looking at. Name it in your mind. And also just notice what it is that you're hearing. So you might be hearing my voice. You might be hearing a buzzing. And come back to that sensation one more time, right? It's still here. Come back to what it is that you were feeling. And one more time, say, I'm noticing, I'm feeling. Just say it into your mind. Come back into your body one more time. Take that last deep breath. And slowly exhale. Okay, thank you all for participating in that. And I will walk you through that exercise and the rationale for using it as I go through this presentation. So as Alice said, my name is Josh Faulkner, and I'm just really humble and grateful to be here with you all today, and just wanted to share a massive thank you to AUT for putting on such a brilliant event. Am I going across? Sorry, Alice, I probably should have.
That's okay. We should have talked you through this. So
Cool.
That's to move forward, and that's your pointer.
Perfect. Okay, so following a mild traumatic brain injury or a concussion, it can be very common to experience mental distress. And when I mean mental distress, these are things like increased frustration, irritability, feeling low or feeling flat, or feeling increased stress or anxiety. Now, the burden and the impacts of experiencing mental distress after a concussion are really important because there is consistent and robust scientific evidence that mental distress contributes to recovery and outcomes following this injury. So we know that if you experience more heightened or overwhelming distress, you're more likely to have more severe symptoms after your injury, and you're also at a greater risk of experiencing a prolonged recovery. So I wanted to talk to you around how this evidence has come to be and why this is occurring. So firstly, when it comes to talking about and explaining this, there is a couple of important things I wanted to highlight in regards to what is actually occurring in a concussion. So a concussion is caused by forces that get exerted onto our brain. And now these forces cause a temporary and a sudden disruption in the chemical makeup within our brain. Now, I'm not going to go into all of the specifics in regards to that. There's far more experts in this room who know all about this. But what it does is it causes an energy crisis. So our brains have this sudden depletion of energy, and I like to talk about this as a fuel tank. So we have this fuel tank, and our brain has a sudden reduction in energy, which causes a depletion of fuel. The other really important point I wanted to highlight too in regards to a concussion is that the symptoms that we often experience from this injury, like fatigue, dizziness, difficulties concentrating, are all what we call non-specific. So these symptoms can also be caused by a whole range of other conditions, not just a concussion. So I want us to hold these two principles in mind because it will make sense in terms of the role mental distress has in concussion. So what causes mental distress in a concussion? Well, firstly, we're not just working with an injured brain, right? We've had a brain that's gone to the injury. And so we know that if you have a previous experience of mental distress, like a previous diagnosis of a mental health condition, or you were experiencing heightened stress or difficult circumstances at the time of your injury, you're at a greater risk of experiencing mental distress after your injury. The other thing too is that our emotions are produced by our brain, right? So if we have an injury to our brain, it will also impact our emotions. Often we think about physical symptoms and psychological or emotional symptoms, but our emotions are biological, right? So if we have an injury, it can also cause emotional injuries as well. The other important factor too that we need to consider is what am I exposing my injured brain to? What sort of stresses are occurring in my environment while I am engaging in my recovery? And I gave a couple of fictional examples, and I hope you don't mind me mentioning this, Sue, but Sue, your example of the amount of stress and demand your injured brain has been in of late is just a real-world example that I think illustrates this more than the examples that I gave, and I hope you don't mind me mentioning that, Sue. So, in terms of our mental distress, what do we do about it? So if we're experiencing heightened anxiety, frustration, irritability, or low mood, it's our natural instinct to go, well, we just remove it, right? Let's just stop being anxious. Let's just stop being frustrated. Let's just stop being irritable. And I really appreciate the humour that comes into this because that's the problem that we have, right? Because if we consider the distress that people are experiencing when they've had emotional symptoms being produced by their injury, if they've got vulnerabilities going into their injury, and also they're having to grapple with all of the demands and stresses that one is under when they are recovering from this often complex, challenging, and really difficult injury, wouldn't it be understandable at times that we would be stressed, anxious, frustrated, over it, feeling flat, feeling down when we are recovering from this injury? So, it's not the emotions or the thoughts that are problematic. It's the amount a person gets stuck in to this distress and how we respond to thoughts and our emotions that causes mental distress to become more intense, become more overwhelming, and become more difficult to manage. So how do we respond to our thoughts? So if we're thinking about our world, we have two worlds, right? We have the world of direct experience. So this is basically everything that I encounter based on what I'm experiencing right now. We as humans, though, have also developed this other world, which is really unique. We have this rich world of language where we have thoughts and images that enable us to think, be creative, and remember things. Now, if one responds to their thoughts in a state of what we call fusion, it means we get so stuck in this world of language. We're so caught up in the words and pictures that we lose contact with the world of direct experience. So in a state of fusion, our behaviour is often driven by rules that we have, reasons for doing things, judgments that we might make, or views that we have about ourselves in regards to things that have happened in the past or that we may predict in the future. So when we experience mental distress, we spend a lot of time fused with thoughts about the past. So we ruminate over past events that are often difficult, distressing, and are often associated with lots of pain. People experiencing high levels of mental distress can also fuse with thoughts about the future. So spending lots of time worrying about all of the bad stuff that might lay ahead. And so for individuals who are experiencing overwhelming mental distress as a result of this injury, there can often be a tendency to become fused with these really distressing thoughts. And that's totally understandable because these thoughts are really, really scary, right? My brain might be permanently damaged. I will never get better. I can't do this because it will cause my symptoms to get worse. Understandably, that when these thoughts come up, there can be a tendency to get stuck into them because it's scary and it's really distressing that these things might happen. We can also respond to our emotions too. And one way that we can respond to emotions is through avoidance. So this means we try to avoid, get rid of, suppress, or escape unwanted experiences. Avoidance is something that we all do, myself included, and avoidance is really effective, right? Because if I don't do something that's not going to cause me to feel anxious, then I'm not going to feel anxious. But what can happen is that if our life becomes dominated by avoidance, we spend more time and energy trying to avoid our unwanted experiences, and the more likely we are to suffer psychologically in the long run. I often call this the jack-in-the-box effect, where I avoid or I suppress my stress and anxiety, and I keep pushing it, and I keep pushing it, and I keep pushing it, and then what happens? And then when I experience this really intense and overwhelming emotion, I then become fearful of it because it's so overwhelming, which then feeds us to avoid it further, and you can see how these difficult patterns can then start to emerge. So if we consider anxiety disorders, it's not the presence of anxiety that compromises the essence of an anxiety disorder. We all experience anxiety. Everybody in this room, myself included, experiences anxiety. Quite high at the moment, I must say. But at the core of an anxiety disorder is excessive avoidance, a life dominated by trying to get rid of or avoid feeling anxiety. And we can also see this play out in individuals who are struggling and grappling with overwhelming and severe mental distress following a concussion. These individuals can have prolonged periods of isolating, withdrawing themselves, limiting the work or social activities that they could participate in, procrastinate or distract adolescents at the moment on their phone constantly as a means of distraction or procrastination. We often see avoidance through overdoing it too, being in denial that I might need to put the brakes on a little bit because of the difficulties that I'm experiencing. Also overly restricting activities because of fear or worry that if I'm to do something, it's going to cause my symptoms to intensify. So, interestingly, when we think about a world dominated by fusion, where I'm stuck in this internal world of language, or I'm engaging in a lot of avoidance, we call this in psychology psychological inflexibility. That is, I only respond to my thoughts or emotions in a really rigid way, which over time can keep me stuck. And our team, with support of Alice, have been really interested in this construct of psychological inflexibility and concussion. And we've done several research studies looking at the role psychological flexibility has in recovery following a concussion. And what we found is that individuals with higher levels of psychological inflexibility drives and maintains mental distress, so they're more likely to have more severe mental distress. And when you have more severe mental distress, where's your energy going to? Lowers the fuel tank, right? Because all of my energy is now going into the severe, intense stress that I have been experiencing. And what does that then do? It takes fuel from the tank, and it also then keeps our concussion symptoms going because my brain isn't getting the fuel that it needs in order to recover. Also, if I asked you last time when you were feeling really, really anxious, what would be some of the most common experiences you had? You probably felt really tired. You might have had a stress headache. You may have had difficulties concentrating, and you may also have sleep disturbances because your mind is racing all the time. As we talked about, these are also concussion symptoms because they're non-specific. So anxiety can feed and exacerbate or intensify these symptoms that we experience following a concussion. What it can also do is that it can take us away from our values or what matters. And I see this a lot in the hundreds of people that I've worked with who've experienced prolonged symptoms from a concussion. And I really want to emphasize that fusion and avoidance is not something that we choose, right? When our tank is low, when we're in survival mode because of this injury, we basically can only do what we can do. So there isn't a choice here. But over time, what starts to happen is that if I'm engaging in avoidance or I'm really stuck or fused in this world of language, it takes us away from doing the things that really matter. And then we can lose a sense of ourselves when we are grappling with this really complex injury. What does that do? Feeds depression, feeds anxiety, keeps our mental distress going, and then we can see a vicious loop start to emerge. So, how do we get people unstuck? So fortunately, we have a psychological intervention called acceptance and commitment therapy, which specifically aims to do this. It's called ACT. So ACT aims to target and increase psychological flexibility by learning strategies and skills. What it aims to do is open us up to what it is that we are experiencing rather than being avoidant of it. It also helps us to connect with the world of direct experience rather than being lost in this world of language. In ACT, we also spend lots of time talking about values and what matters. So in my work with individuals with a concussion, we don't talk about a concussion. We talk about what matters. We talk about the things that are important to them. How can we get you back doing those things that are really important? And so at the start of my presentation, I got you all to increase your psychological flexibility. I got you to open up to what it is that you're experiencing. I got you to acknowledge it rather than pushing it away, rather than avoiding it. And I also asked you to get a little bit of distance from it. So I am noticing, so there's an I who notices, and there's a feeling. And by being able to get a little bit of space from it, it often doesn't feel like we're so stuck or overwhelmed in that feeling. I also asked you to connect with the world of direct experience. I asked you to connect with your body through movement, through breath, and I also asked you to engage your senses. That technique's called dropping an anchor, and it's based on ACE. Acknowledge, connect with your body, and engage your senses. It's perfect for when you need a brain break, right? So I am somebody who is so aversive to, this is my own experience, 15 or 20-minute brain breaks, because what 15 or 20-minute brain breaks do is they take me away from my external environment, but where does that leave me? It leaves me in here. And so often when I'm having a brain break, my thoughts are racing, I'm worrying about all the things I need to do. What does that do to my stress and anxiety? amplifies it. What does that do to my fatigue? Intensifies it. So if we can do little techniques like dropping an anchor 10, 15 times a day, where I'm waiting for the kettle to boil, I take that moment and I drop anchor, it just gives our brain a little bit of respite and it gets that fuel tank back up. So our team has been really interested in the application of ACT in mild TBI, and we have developed a 5-session intervention called Action MTBI, designed specifically for individuals with a concussion. And what we've done with this intervention is that we've applied those principles of opening up, being present, and doing what matters within a concussion context. It's a 5-session intervention. It's skill-based and it's practical. I'm really excited to share with you that we have recently completed a feasibility study where we have compared individuals who've completed Action MTBI, those that engage in usual psychological treatment. These are treatments that don't target psychological flexibility, and I'm happy to talk more about those if you're interested, and also controls who didn't have psychology as part of their rehabilitation. As much as we can, these groups are matched in terms of time post-injury, as well as the severity of all of their outcome measures. What we've done is we have compared their scores before they engaged in treatment and after treatment, and higher scores on this graph depicts a greater change. So we hope to see a greater change if the intervention has been effective. And what we found is that in usual care, we have this kind of consistent pattern that's been demonstrated in the literature, is that this intervention seems to really help mental distress, but it doesn't seem to be as effective across the board of other MTBI outcomes. What I'm super excited to share with you is that our Action MTBI intervention not only has had a really significant effect on reducing mental distress, but actually has a more generalised effect at improving post-concussion symptoms, increasing functioning, and doing what it's supposed to in terms of increasing psychological flexibility. But this is only a feasibility study. We're in the process of developing a full clinical trial. So hopefully if this event is repeated, I'll be able to share those findings next time. So what does this all mean for me? So mental distress contributes to ongoing symptoms after a concussion. It's so helpful that we understand how mental distress develops, because hopefully it gives us some compassion that mental distress is normal, it's understandable, and it is an emotional injury that we experience from this event. What is problematic though is that if we have high levels of inflexibility that cause us to get fused with the thoughts that we're experiencing or avoid feeling certain emotions, and this becomes our dominant default, that then drives more distress and keeps us stuck. As I've shared with you, we are developing treatments that specifically aim to address this. Our results are super promising so far, and we're hoping that this can be more of an intervention we use within our services. So finally, I just want to acknowledge this amazing team, the Health Research Council of New Zealand, who's been funding our work, as well as these providers. So that's me out of time. Thank you.
Kia ora. Thanks so much, Josh, and thank you personally for that little mini brain break. I really appreciated that. So we have got time for a couple of quick questions. Yeah, the back.
When you do your next piece of study, given that you're looking at the distresses and that, will you have an element of the study that will have people that are having to deal with ACC versus people that don't? Because that is adding a massive distress on the people,
Totally.
causing a lot of distress.
Yep.
And I think we need to somehow have some research into that to be able to prove to ACC they're actually causing further damage, and actually, instead of them getting people off in 3 months' time, they're actually causing their symptoms to be prolonged,
Yep.
as you state,
Yep.
because of the way they're treating the people with concussion.
Yeah, no, I couldn't agree more. We know that there are huge challenges and often navigating these challenges when we have a brain injury often feels impossible. One of the things we like to do with this intervention is empower people to use strategies and techniques that they can then put in place